Morning everyone, Dr. Eric, the fitness physician, where I talk about all things related to hormonal fitness, muscle medicine, anti-aging, and much, much more. So I've been doing a little video series based on this paper that I read and was reviewing, because this question comes up a lot, right? Especially with my men and my women who are on testosterone therapy. When can I expect to see results? So if you missed the first couple, go back and watch those. I explained a lot, especially in the very first one, which was very important. It's very nuanced. It's not very cut and dry. And that's why there's so much individual variation. That's where my physicians, other medical professionals' expertise comes in tweaking this, because most people, especially non-medical people, when they're coaching people, that, and I say that with air quotes, that oh yeah, just go up to this and just do that and just do whatever because it's just cookbook, right? It's easy. It's not. And I've seen people get harmed and have bad side effects from doing it improperly, not working with medical professional, working with these quote-unquote hormone experts online who don't have medical training. So sorry I keep harping on that, but my first and primary concern is the safety and care of my clients and patients, as should everybody. So this one is the one that comes up all the time, right? Body composition, right? Everybody wants to know, man, when am I gonna get rid of this belly, man? Get rid of this fat and get rid of this spare tire and lose these love handles and tighten up my butt and all that good stuff, right? So, and when am I gonna put on some muscle, get some arms and stuff like this? So yes, it can definitely help with that. So one of the cool things about testosterone is its effect on mesenchymal stem cells. It can actually influence the determination. It's basically the determination of the lineage of these stem cells. In other words, they start off as what are called pluripotent stem cells and mesenchymal stem cells. Then go down the adipogenic line or the myogenic line, meaning go into muscle or go into fat, right? And obviously we want more muscle, less fat. That's why I'm all about them. That's why I'm called focused on muscle medicine, right? And that can influence this at the cellular level. This is, again, why I practice cellular medicine. We're going to treat these stem cells, and it has other effects on metabolism, which is going to further influence this, as we'll talk about later. So that's the cool part. So the bottom line, again, there's several paragraphs in the article. I'm going to cut to the chase. You know me, I like to just give you the straight stuff. Increase lean body mass and decrease fat mass. That's the goal. And again, quite a bit of variability here. Men have lost some weight and then put on some muscle mass, and sometimes the weight changes, sometimes it doesn't. I know a lot of my female patients sometimes get concerned because sometimes initially the weight will go up a little bit and then it levels off and then it'll start to lose. But during that period, they'll find that their clothes sizes are fitting better. Their pictures are looking better because they're leaning out a little bit. And it's not as quick, as dramatic as it is men, but it definitely happens. In general, most of the time within 3 to 6 months, you'll start seeing some changes, but I always tell my patients, give it at least a year, if not 2, to really see dramatic changes in your body composition, because it just takes time, right? It's a cellular process, it's nuclear transcription, burning fat, all these different things. It takes a long time. But progressively up to 12 to 24 months and beyond. If you go back and check out some of my other videos, I did several videos specifically for diabetics, patients, and hypogonadal men who progressively lost weight up to 12, 24, 36 months and beyond. In other words, the fat loss was progressive. They kept their BMI, their waist circumference kept going down, and actually reversed their diabetes. Not much else you can do, I'd say, about that. That's all I'm going to say. So again, truncal fat, visceral fat, and waist circumference. The truncal fat, of course, visceral fat is the dangerous kind, which leads to inflammation, highly linked to metabolic syndrome, diabetes, and obesity. So it's very correlated. We want to get rid of that as fast as possible. So we see a drop in waist circumference, again, from 3 to all the way up to 24 months and beyond. And then there's several studies that indicate progressive loss to that up to 36 months. And one study, or I think over 110 weeks. It's a long time. And then another one talking about just overall BMI up to 6 to 24 months and beyond. And again, BMI a little more of a vague measure because that can vary, but overall still very important. And a lot of studies have correlated BMI with some of these conditions that I just talked about. So the important thing is it tends to be a progressive thing. I always tell everybody, give it a year to really see huge changes. Again, are you going to see that before then in 6 months or so, 12 months? Yeah. But a lot of patients are going to see more 12 months and even beyond, and again, progressively past 24 months, which is amazing. You know, anytime you take get on a diet program, weight loss program, or you try a new diet pill, most of them don't work, right? You lose it, but then you gain it right back. This is something that by optimizing your hormonal environment, you're going to get sustained and progressive changes, and that's what you want. You want to put on the muscle, lose the fat, and keep it that way for a long time. And that's what you can do with optimal hormone therapy, not just testosterone, but other things too. And as I've talked about before, a lot of this comes from estradiol, and I forgot to put that on the screen here. But good old testosterone, right? It gets converted, a lot of it gets converted into estradiol, and this can lead to fat loss. Even more so, a lot of the effects of the fat loss actually in the body comp actually comes from the estradiol, not yet another reason you want to optimize your estradiol levels with men and women. So again, I've talked about this for years. This is why with men, they're always saying, I need to get my estrogen lower, or do I need an estrogen blocker? No, you don't. This is why. You want bone mass, and you want fat loss, and you want libido. Libido, as I've talked about before, is often driven by estradiol. A lot of people think, oh, too much estrogen, that's why you're, having problems with sex and intercourse and libido. It's not really the case. You want it optimal. Again, you don't want too low, too high, but a lot of this comes from estradiol and then DHT, which I've talked about in previous videos as well. So it's all about optimizing that hormonal environment. It's very complex, and all these dominoes affect one another. So you mess with one, you mess with another. So anyway, I hope you liked that one. I'm going to talk about some more effects and time changes on testosterone in the next one. So tune in for this one. Like this post, tag it, share it, let me know what else you want to talk about. Check me out on drericprimex.com. I'm launching my cellular nutrition and fitness basic overall lifestyle course here this month, so check it out. You're going to love it. I got a lot of information on my social media channels and doing consultations across the country. So reach out to me if you want to learn more, if you want to sign up for a consultation. Got a lot of products on my website, free and for sale, and then I'm going to be launching my weight loss course for women very shortly too. So women, you're going to love it. So everyone, have an awesome day, and we'll talk to you soon.